From nurses to dentists, podiatrists to learning disabilities, counsellors to musculoskeletal services and lots more. There are so many examples of good practice, hard work and adaptability to be recognised. A temporary hospital was set up at UCLan to assist with the pandemic, but we start with a startling statistic that district nurses saw a 200% increase to end-of-life care incidents during the COVID crisis. Nurse Becky Wild wrote a poem of reflection.
In my eyes, therein lies my sincerity. In my smile, therein lies my warmth. In my touch, therein lies my compassion. As a nurse, these forms of communication are so important to me. I asked one of my wonderful patients at end of life today, who was non-COVID, if he had any questions, and he replied, "Am I going to get better?" I had an open and honest conversation and I had to tell him no. He was now in the terminal phase of his illness and his condition was only going to decline further. We would be here all the way with him to support him to die where he wanted, at home, with his cherished dogs and his beloved family at his side. I had to tell his doting wife the procedure to follow in the event of her husband of 53 years' death. All this behind a mask, all this behind steamed up lenses, all this without being able to hug. It was so unbelievably hard. I've never felt like I did today before. I told him it felt wrong. I've never had to have a conversation in this way, that it was new for me and that I'm sorry I was behind a mask. Nursing for me is never about me, it's about my patients and their experience. So much of their experience relies on our ability to communicate non-verbally. I was challenged today. I found it so hard behind a mask, behind lenses, without touch.
Our staff have shown great resilience in being able to respond to the increased demand that they've seen, and that's been enabled by support from wider teams within not only the nursing workforce but also within wider network teams. So for our example, our frailty services, our frailty teams have supported district nurses to take some patient visits for them so that the district nurses will be able to concentrate on seeing people at home.
I'm so proud of the staff and the Community and Wellbeing Network. They're always amazing. They've always been incredibly hard-working, really dedicated, real can-do attitude. But I think this year we've been tested and we've tested them. Gone beyond pride, actually. I get quite emotional sometimes when I think about what our workforce have achieved this year. The treatment room nurses, who are quite used to working in clinic settings, actually really stepped up and they joined the district nursing workforce. So they started to go out and about and work alongside our district nurses to deliver care in people's homes and to make sure that we had the capacity to meet that increased demand as well. We've moved to various digital platforms. One of the big ones that we've worked with is something called Attend Anywhere, which really just allows clinicians to use their computers and their phones and things to talk and communicate and assess people remotely, when normally we'd have brought them into services and we'd have done things face to face. Now it's being done through these digital platforms. The therapy services right across the board, physiotherapy, occupational therapy and our speech and language therapy services have just adapted and changed the way that they work. They use Attend Anywhere. I've heard stories of occupational therapists doing assessments and home visits through kitchen windows, using telephone technology, and just everybody doing things differently. Physiotherapists delivering care plans using Attend Anywhere. And sending out the equipment and so on that's needed for the patient to be able to carry on their recovery journey. In terms of another service that's done really, really well through COVID and changed the way that they're working, we've got the Moving Well team in Central Lancashire. They've done amazing things really differently. The pain service actually completely changed the way that they worked, and we had people like our GP-SI, that's a specialist GP in pain. Actually, he wasn't able to do his clinics in his normal way, so he completely changed the way that he worked, and he supported some of our rehab services and some of our community beds in Central Lancashire. And then the teams themselves really stepped up and changed the way that they were working and offered to support our rapid physiotherapy and occupational therapy services, and went and changed the team that they worked with and supported us not seeing people going into hospital, and supported getting them out of hospital a lot quicker as well. The next service that has done remarkable things over the summer period have been Minds Matter IAPT, the psychological therapy services that we've got in the network. So these services were already doing incredible work in terms of trying to manage lots and lots of people that have psychological needs, high numbers of referrals every week, and managing really big waiting lists and trying to bring down the wait so that people are seeing quicker.
It's an evolving service. The complexities that we're presented with, we kind of manage them quite well, and I think that's the resilience of our staff, really. They manage to face challenges and they get on with things. Sometimes it's, well, not sometimes, I believe all the time, it's the staff on the ground that make the service what it is. And I think based on patient experiences and feedback that we have, that they always appreciate the level of service that they get once they're in the service. I think COVID, if anything, what it's allowed us to do is address some of the waits that we had as a service. And it's allowed us to work with clients in a productive way. We found that people are actually engaging more because of COVID as well.
One of the things that we were challenged with for our phlebotomists was they had a model of just drop-in. So people just came, and they came in large numbers often to go to a clinic. So we had to very quickly work with our admin staff, who are absolutely brilliant actually, and get us set up to do an appointment system for phlebotomy, which was a drastic change in how we worked. But alongside that, the phlebotomists also needed to move into a model where they were wearing an awful lot of PPE, full PPE, the aprons, the gloves, the masks, visors and so on, which is a really difficult way to work. And they're not the only team that we've got that's worn full PPE, but they're one of the teams that have really had to intensively start to use that for long periods of time.
Most of our patients, obviously, they deal with a respiratory condition, so they've got a long-term lung condition, so a lot of them fell into the shielding category as well. So we've had some patients that have not been out at all, so we've been providing advice to help them as well whilst they've been shielding. But we have actually had some patients, unfortunately, who ended up with COVID and fell really unwell. So we've had a few patients who've ended up in ICU, and luckily obviously been discharged back into the community. So we've been actually prioritising some of these patients that have got quite significant symptoms and can't get back to functioning again. So we've been actually going out with those patients in full PPE to do home visits to see where they're at in their function, and then try and get them back to their level of independence again.
Our staff have been redeployed into loads and loads of different areas. They've helped with the swabbing team, swabbing staff, and also swabbing the general public who've contacted for tests. We've been part of the antibody testing team, so the dental nurses have learned, and the therapists have learned how to take blood, so they've been trained in that. So they've been around testing all the staff. We've helped with the trust advice line, giving advice to staff when they've rung in with concerns, and also the medication treatment clinics, we've helped with those as well, supporting staff to help maintain social distancing and to guide people in and out of the buildings. So they've done so much while they've been away from the service, and those people that have stayed in the service have done so much work to get us back up and running again, and we are so proud of what they've done, how they've been flexible and responsive. They've been so resilient. We've thrown new things at them sometimes nearly every hour, and they've just adapted and worked on it and made things work. So we're amazingly proud of everybody in the service and those that have been redeployed and are now coming back to us.
This is a good time to be working in learning disabilities. I'm really grateful to my chief exec for giving me the opportunity of coming back and working on in learning disability agenda, because as the executive lead for learning disabilities, I've got a fantastic opportunity now working with fantastic clinicians and healthcare and social care workers and colleagues in the ICS and commissioners to really work together around really doing what we can to make the services that we provide in Lancashire and South Cumbria services of excellence, and that's what I'm aiming for, to really go for excellent care to people with learning disabilities, with people with learning disabilities.
This is really exciting for us, and I think it's really exciting for Down syndrome as well, having never done this before.
We engaged with a charity called Down Syndrome, and Down Syndrome was set up by a young lady called Jen and her parents because Jen wanted to dance. And then Jen has Down syndrome, and she couldn't find anywhere who would support her. So her parents set this up, and Jen is now a fully fledged dance instructor and runs Down syndrome, which is mainly in the east of the patch for the trust, and engages people who have a learning disability or people who don't have a learning disability, and engage them in dancing, and they meet quite a lot and do lots of different things. So as part of Learning Disabilities Week, what we did was had several conversations on how this would work, and we arranged for a virtual dance to happen. And on the day, Jen, her parents and her dance instructors all came on, and some of the people who are a part of Down syndrome came online through MS Teams, and basically did a bespoke dance for us, but also got us dancing as well, which was great fun. The reason we engage them is to really raise the profile of that people with learning disability can really break down barriers and really make a difference. And what Jen and the other members of the Down syndrome troupe talked about was how it's made them feel more confident, how it's made them be more independent. Jen now lives alone, away from her parents, and it was just great to see and hear her story on the difference just doing something she wanted to do has made. And hopefully as we move on, our relationship with Down syndrome will grow and grow.
The Lancashire Recovery Centre is a unit that we opened, which is at UCLAN, which everybody knows is in Preston. And we worked as a whole system to get that centre up and running. We worked with a number of partners. We had our own team from the network, which Carol Scott headed up. And we effectively, along with the Army and with the acute hospital as well, we shut down what was UCLAN's gym, and we got it fit for purpose and ready to open it as a big recovery centre, as a hospital really. We didn't open it, and it was really good that we didn't open it, but if we needed it, we'd have had it.
I'd like to say how proud I am to work within the Community Wellbeing Network. I work with a fantastic team. Each and every one of our team goes the extra mile every day, particularly over the last few months when we've really stepped up to the challenge that COVID has been to us all, and we've worked differently in different environments using digital technology as well. And we've really continued to make such a difference to patients. I hear on a daily basis lots of the good news stories, lots of the positivity that patients and carers feed back to us, and that just is testament to what our teams do on a daily basis. So I'd like to say thank you to each and every one of you for your contribution. It makes me proud to be part of it. Thank you.